Good afternoon, everyone. It's actually quite encouraging to see so many audience in the room, given the rally that we have in the area, and also that it's a post-lunch session. But I'm sure you're going to enjoy and learn from this session because we have such a wide variety of organizations and eminent speakers and leaders here in this panel who will bring out different aspects of the topic that we're going to be discussing. Before we start, I just wanted to see a raise of hands of people who believe that primary care is an area where there could be private investment. Okay, not too surprised, not many hands. But it has been estimated that the market value for primary care is 13 billion US dollars. And telemedicine itself has been estimated as $5.5 billion. Now, having said that, one has to be very careful about, what are the areas and components where investment is possible in primary care, and why are we even talking about primary care? Why is it so important? Many people here in the room must be aware of it, but for those who aren't, it's foundational. It's the basic preventive, promotive, and curative care that is provided. And the reason we emphasize on the point comprehensive is that it has to cater to the needs of sick and ensure that it is moving towards wellness. And thanks to the government initiative on Ayushman Bharat Health and Wellness Centers, which actually has a huge focus on comprehensive primary health care, and it's a huge initiative. And under Ayushman Bharat, we have 3 other pillars which complement the provisioning of primary healthcare services. Now, all of us know that there is a huge gap in investing, actually financing for sustainable development goals, right? And because of COVID, this has been increased by almost $1.7 trillion. So it is more commonsensical that the more investment we have in the healthcare space, it's better. But where? And when we talk about government and private and civil society organizations, we think of them as monoliths. It's not one government. It's not Ministry of Health. It's not only Department of Health. There are different government agencies. It is center, state, local, different components. Likewise for private sector, likewise for civil society organizations. And I'm so happy that we have all the sectors being very well represented here in the panel. So the objective of this panel discussion is what are some of the patterns or what are some of the experiences that we have seen of different stakeholders coming together to provide for comprehensive primary healthcare, which is a huge requirement because if you invest in comprehensive primary healthcare, you can actually improve the quality of life for people, reduce morbidity, reduce mortality, and reduce your overall healthcare expenditure, not only on out-of-pocket expenditure. And evidence has shown that. So how do we collaborate? What are those areas where we could collaborate? And how do we nudge and identify potential areas to collaborate in the space of primary healthcare? So our first question or a round of questions would be focusing on highlighting the existing opportunities for private sector engagement in primary healthcare. And my question is to Karthik from COIS. So can you speak to the existing opportunities for private sector in the area of primary healthcare, and what lens does COIS apply in identifying those opportunities?
Thanks a lot. Just briefly, right? So COIS has been an impact investment firm since 2010. So we've had 2 funds. The first fund is called the Health Quad 1 Fund, and the second one, which was launched more recently. And through these, we've been making targeted investments in the context of healthcare ecosystem in India. And the kind of lens that we have been using while we make these kinds of investments is basically predicated on 4 pillars. The first pillar is that of accessibility. The second one focuses more on affordability. The third one focuses on improving consumer awareness, and the fourth speaks about quality of care. And just briefly talking about what affordability means in this context. In this context, it means that we focus on driving profit and growth through volumes, and therefore it's really important that more people are in a position to access the kind of care that's available, and that in turn helps lower the cost of care. And the way in which, I mean, and there are a few instances of the kind of investments that we've been making, and I'll speak about that subsequently. The second one is focusing more on affordability, which is basically trying to address the barriers which are both related to the timeliness of seeking the right kind of care at the level of primary care, as well as addressing the geographic barriers. And in that context, what is very, very critical to observe is that we focus on decentralizing care. So therefore, it's not just focusing on triaging or screening and diagnostics, but really providing comprehensive primary care as a first point of care. And the third focuses on really building consumer awareness as well as broader knowledge, so that there is really positive health-seeking behavior. So through these, right, the kind of existing opportunities that we see, which are probably relevant to primary care, focuses largely on a trend of digitization. So what I mean by that is really advancing the value care pathway in such a way that you are in a position to access care wherever you are, or in the context of the community in which you really reside. The second trend that we see, which is really rapidly emerging, is trying to leverage artificial intelligence as well as data analytics, which really focuses on ensuring that personalized care is available, standardized treatment pathways are available, which can really over time lower the cost of care. I'll just pause there for a bit, but these are the two trends that we see definitively driving private sector investment in the context of primary care. So.
That's amazing. That's amazing. Thank you for raising those points, especially in terms of the criteria that you look at, and focusing on affordability and access aspects of it, and also looking at comprehensiveness of it. So we'll come back to you for examples in the next round. The next question is to Dr. Suranjeen. As a non-profit working on the ground, have you seen an increased interest of private sector for funding for primary healthcare components? And have you seen that there is a renewed interest because of COVID, post-pandemic? And how much of that actually relates to the needs on the ground?
Thank you. So there's definitely, quite a bit of interest in primary healthcare, simply because the government is at this moment, putting in a lot of investments. As you mentioned, Ayushman Bharat. Most of us, when we think of Ayushman Bharat, we think of the PMJAY and the insurance, but the work in primary healthcare is equally big. In fact, much more bigger investments coming in there, where they're trying to get various building blocks to come in, starting with human resource, and then with brick and mortar infrastructure, and now with systems coming into place. So there is a lot of, things that, need to come in and be catalyzed. As you mentioned, telemedicine is one of them. But the government is thinking that each of these health and wellness centers, and now we are talking about over a lakh health and wellness centers across country, will have a pharmacy, will have a lab. And what would that mean? And how would samples get transported? How would supplies come in there? What would be the services? What about point of care diagnostics? These are some things which at one time, even if you were talked about it 4 or 5 years back, it would have been in the realm of imagination. It would have been in the realm of possibilities. But today we are talking of it actually happening, and actually can be catalyzed. And I think the most important thing is, apart from what Karthik mentioned, data and technology, but I think is this innovations to improve systems, to actually see that these works. But apart from it being what the government is serving, we're also looking at places where the government, unfortunately, is not able to reach. And sometimes we may think of really far, hard to reach areas up in the hills, but sometimes it could just be slums in your urban areas, which the government just can't reach. Some governments have tried innovative methods, but the Mohalla clinics that have been tried have not been talked about. What has happened? How do we catalyze that space? Can private investments come in? Are there models that actually can work there?
Great, thank you really for bringing out the aspect that when we think of private sector, it's just not private healthcare providers, right? Like we have the entire ecosystem, we have suppliers, we have labs, we have pharmacies, and there is already existing vibrant private sector provisioning these services for primary healthcare services. And we look at it in siloed way, but that's not true. For services to be available in the remotest areas, it's extremely important that the other arms of the health systems are functioning well. And one of the important stakeholders in this is the not-for-profit sector or the civil society organization. So coming to you, ma'am, with regards to your work, very similar question to what I asked Dr. Surenjin is, what is the trend that you have seen, especially with not-for-profit sector? Obviously, they have been working in the most vulnerable and isolated pockets. But with COVID, have you seen that there has been renewed interest and interest even by the private sector to work with them? And how much of that is relevant in terms of the needs of the community and how both for-profit and not-for-profit have responded to it?
So COVID is a time, and post-COVID, if I may dare say, given the increase in numbers, but I'm going to be positive and say post-COVID, is a time for every sector, not just the private sector, but government, NGO sector, to reimagine how we are going to not only deal with the fallout from COVID, but going forward, knowing that there are a lot of unexpected disasters that could happen, given and have happened with SARS and other areas, we have to rethink. In terms of the interest, everybody, I think, has realized three things. One is that our health system, our public health system, and nor our private sector were totally prepared. There is a fragility in the public health sector. Some people say, the ones who are more pessimistic, are public health sectors in ICU. It's close to it. And I think the private sector has a huge responsibility given this. But what the private sector did during COVID was a little disappointing in terms of, first of all, we realized that in the most remote areas, the private sector is missing. We knew it, some of us knew it, but now it's proven. And private sector needs to create opportunities which may not maximize profit, but to go to the remote areas. And telemedicine and many experiments that you have also done and others have brought in, technology is a contribution in the right direction. And given the remoteness, neither the public health nor the private sector is going to function fully. So using technology is something that I'm seeing in not only startups, but I'm seeing in the private sector in many of these new wave technologies, as well as young people investing in the public health sector. That's very encouraging. In fact, we don't know enough, but through COVID and post-COVID, I've heard of so many experiments. Now, from our point of view, we found that one area where neither government nor the private sector, maybe some ad agencies may know a little bit how to sell products, but they don't necessarily know how to communicate with rural people on preventive health care. So we played, the role we identified for ourselves, and we helped a lot of governments, state governments, NGOs, plus we managed the MyGov page by doing behavior change communication, which was much much before we knew what to do and there were medicines that could cure or, help. Behavior change communication is one area where not just for COVID, but for the entire health sector, we will bring down the cost of healthcare, we will bring down the well-being of our people, greatly improve it. If we invest in health literacy, and if I may say / behavior change communication. And there are some areas that the government just cannot, it'll take us years, for instance, for counseling. Now just take contraception. Contraception requires pre-counseling and post-counseling. And every contraceptive has side effects. I always say try abstinence. It probably has the biggest side effects. So, this is something we can talk about we can use even areas, not just behavior change communication, but we can use augmented reality, for instance. And we are already experimenting, by the way, how you can do counseling using augmented reality. And this is the direction, I think, the private sector, which is technologically more advanced than the government is in terms of, the bureaucrat is not trained in everything, right? So another area of interest we've seen is from the private sector grants, both from philanthropies as well as from CSR. Look at Give India Foundation, the amount of money they were able to raise is phenomenal from across India. Even though PM Care took a large chunk of the money, we still had more than crumbs for the NGO sector. No, sorry, from the private sector and the corporate sector, and that shows an interest. And those in the private sector present here, keep it up, increase it, step up. And I'd like to say that we also saw that the one area a lot of private philanthropy is interested in is the heroism that the frontline health workers showed, the women especially. Where were the men? I don't know, but women were right in the forefront. ANMs, ASHAs, Anganwadi workers, they were the heroes of COVID. Heroines and heroes. Sheroes is the politically correct word for them. And we've seen a lot of people from Azim Premji Foundation to several others suddenly want to invest in them, their capability and so on. And I think that's very exciting. And finally, using digital technology, using to train government health functionaries as well as others, NGOs who weren't doing health before they got into, there was this rapid rural transformation group that came up of 60 NGOs who did amazing work. And then India, frankly, I would like to bring in the government here also. While the government didn't particularly do a good job of COVID cure and all because they didn't have the infrastructure, and that's not an excuse, it's a wake-up call. But the government clearly on vaccination used our infrastructure across the country and did a great job of vaccination. So that is a lesson we have learned of, again, private-public sector partnership. It is the private sector really has to be complemented in India because India is not willing to buy vaccines and pay foreign exchange, and understandably so. So India, going forward, the vaccines, is a role, again, the private sector in India can play and has recognized and has been celebrated. Mr. Poonawala is a hero and a rock star today. So we hope the private sector will play a rock star role, but I do want to say if there is real partnership and engagement we want to bring in of the private sector, we have to trust them, we have to separate the wheat from the chaff, and the government's lack of trust actually at the end of the day in private sector. And the private sector has given reason, of course, to the government, but I think we need regulation in the private sector, but not control. Government's overreach, we don't want to kill the private sector in participating in the public health sector. And primary healthcare, we need them because we don't have the infrastructure and the fragility, given the fragility. So regulation, but with an independent, like in England, they have nice standard setting agency. We don't want government to stifle public-private partnership. Sorry,
Thank you, ma'am. And as always, you've been passionate in what you mentioned. And very clearly, there is a huge scope for private, not-for-profit, and government partnership, as you rightly said. And I think we'll get into examples in the second round and, discuss more about this. But as you rightly said, government needs to play the regulatory role well so that there is this, the trust deficit that exists on both the sides that could be minimized, and there is enough opportunity and platforms for, different stakeholders to come together and work. And there are ample of examples on that. So thank you for that point. And Mr. L.M. Singh, actually, you have, it's been a pleasure to work with you and know you. But in your new role with Vital Strategies, you're also looking at beyond health, right? Like we all know there are social determinants which has a huge impact on health. So can you speak to the intersectionality in healthcare that has often been overlooked by the government and the private sector? And how can private sector engage in those areas, especially in the primary healthcare space?
Well, thank you, Neeta. And I think after COVID, I'm meeting you back again, and wonderful to be here. You bring an interesting point, and since COVID now, healthcare is at the center stage of both the government and I think even in the minds of people. And this intersectionality, if you look at it, it's an interesting dimension which largely gets ignored many times by people and by the government. And if you look at the data today and you look at the social detriments, the impact on health, you look at the environmental impact, which it has on your health, the gender side, the ethnicity, religion, all of them directly or indirectly are contributing to our well-being or lack of it. And I think they play a big role when you look at it from a primary healthcare perspective. Just to give you an example, if you look at the social side, today with increasing urbanization, you look at packaged food and so on, the quantum of trans fats being consumed, or you look at, alcohol and its impact on people and their health, over 200 diseases which are linked to it. Tobacco, both eating and chewing, it's a huge social problem and a health problem where more than, close to 1 million people are dying every year. So, and the list goes on. And if you look at the environment side, I think clearly we all know, living at least in Delhi, how important the air quality is to your health. I mean, today, I would say at least 2/3 of a big 100 cities have a very high level of pollution. And clearly, they have an impact whether on your lungs, on respiratory side, on the other diseases could be on cancer, heart, and so on. So clearly the list is long. And I think these social detriments or the environmental detriments cannot be ignored. And Vital Strategies, who I represent, they've been working on these problems for a long time. I forgot to mention things like metal toxicity is a big one. I don't know how many of you know that in India itself, lead poisoning, it's estimated if there are 800 million people who suffer from high levels of lead toxicity. In India, they're close to about 270 odd million. That's a huge number in children. And it impacts your IQ, your cognitive ability, your heart, and so on. So I think if in the context of the primary setup and you look at the role of the private sector, I think we are fortunate to be living in a country today where private sector is robust. It has the ability to innovate. It has the ability, once it makes money, to contribute back, whether it's through CSR, giving, and so on. So I think that going forward, a lot of these, if I can say, the social and the environmental things need to be integrated into our primary health system. For example, we've been working in the state of Madhya Pradesh and Indore, looking at the training of ASHA workers in environmental health and the impact. Two of the USAID programs, Clean Air Catalyst and Clean Air Better Health, again, we're involved on the indicator side. You look at alcohol, I think this de-addiction and the counseling, these things can be done at a primary care center level. You look at, the training of the workers, you look at screening. I think these are all areas where one can have both the government and the private sector come together. And it's not necessarily about providing the treatment. It's also to do with, the training, the capacity building. I think Poona made a great point around behavior change. I mean, clearly, these things have to come from within. And we've run media campaigns which tested evidence and showed that, you can actually cut down tobacco consumption if your messaging is right and people understand. I think same applies for alcohol or for that matter, trans fat. So I think all these will have an impact in the long run on our health, our population. And Vital does work in India in many of these areas on training, capacity building, screening, behavior change. And my passion, as you know, has been on the blended finance. I'm a big believer of private sector, just to qualify that. And I believe the both have to go together. I think government has the scale and the capacity, and the private sector certainly can innovate, and if regulated rightly, can contribute. So those are my views. Thank you.
Thank you so much, LM, for bringing up the different areas of where there could be intersectionality with health, and also for giving some of those examples there. I think what we miss out is we have too much of a verticalized approach, and I think it's true for all of us, most of the organizations, the way we are structured and we function. And comprehensive primary healthcare is actually a platform that that actually provides us that space to come together, because I don't know how many of you are aware, but it really covers like around 12 areas across health, and which has a lot of social determinants impacting each of those areas, and 8 components, which again is like across the board addresses a lot of different social determinants. Thanks for bringing that up, LM. Going to the second round, and here I have a request. We should keep our responses limited to perhaps 2 minutes. Yeah. So because we are running out of time. This round is more about private sector and government as a key stakeholder for scale. So we've been discussing about what are the areas, but this is primarily for scale up. So, ma'am, beginning with you, post-COVID, what are some of the challenges that women and adolescents have seen, and how can governments and funders actually come together within the primary healthcare space to address them?
Thank you. So, COVID-19 absolutely has created or presented unprecedented challenges for especially women and girls, but also young people in general and the entire country. But for them, it's the problems already existed actually. It's not that new challenges came, whether it is one of early marriage. Families felt insecure about the girls going back to school and investing in girls with the economic entitlement failure within the families. So girls were taken out of school with no possibility to go back for many of them. Early marriage took place, again, because of economic, financial, and security reasons. And violence was experienced by a large number of women who were held captive with their perpetrators in the house without being able to step out or even have an opportunity to make a call. So these were just 3 I'm mentioning, but again, we have seen anemia went up for both girls and boys, but there was, again, the economic entitlement failure impacts girls and women more. Girls are the last and least. They eat last and least, and some of them, it got further reduced. Nutrition values went down further. So education, health, nutrition, safety, economic, every aspect of the lives was badly affected. And this led to studies that have been done by us and others, especially with adolescents. Can you imagine in Bihar, 83% of the adolescent girls said that they've had anxiety attacks and counseling. The mental health burden in the country, and especially for this community, increased drastically. So what can you do about this? I think we need to make greater investments in girls and women. And whether it's public health or education, India needs to, I'm not going to be able to. Yeah.
So, Karthik, this question is for you. You did mention about the metrics that you apply and how you make the investment choices in your previous round of question. So, if you could share some of the investment success that could be scaled up, and what has actually enabled the scale up, and how, as a funder, you actually look out for innovations that could be scaled up.
Yeah, thanks a lot. So I think there are a couple of ways to address this question, but first, speaking about the kind of examples through these two funds that we have deployed, what we have seen is that there has been a top line growth which has been in double digits, and I think the cumulative investment and their successes also speak about the fact that we are on the right path to really identify the right kind of investment opportunities, and these are focusing on non-communicable diseases. These are focusing on behavioral lifestyle modifications to ensure that we are in a position to catch, screen, or triage the specific chronic condition as early as possible. So I'll just focus on two examples. We have invested in a firm called Neurosynaptic Communications. Now this organization focuses on providing teleconsultative and telemedicine services to more than 26,000 pin codes across the country, and they have over time really reached out to nearly 100,000 people outside in their community through the kind of outreach camps that have been implemented. And what they essentially do is that through telemedicine, they provide access to screening, triaging, and referral care, both at the level of primary care and beyond. And I think this is a great example where we can try to figure out how to address accessibility to the underserved segments by really leveraging technology. Uh, uh, a second example that would be worthwhile mentioning is basically e-pharmacy setup called Medica Bazaar. Now, they are a firm that really leverages artificial intelligence as well as analytics to ensure that the right kind of product mix of both the diagnostics as well as the generic medications are being provided to mom and pop pharmacies. Now, what that does is that by trying to study the patterns of use and conditions which are really prevalent in the underserved segments, you are in a position to design the right kind of product mix. And when you do that, your working capital operational expenses go down. And that is the kind of value that can then be transferred to the retail consumer, who in turn pays less for the same kind of solution. And this has resulted in shortening the turnaround time for the medicines, and it has really made them cheaper also. So these are two examples that I can speak about, which really talk to how we have basically identified opportunities at scale. And maybe to speak a little bit about the parameters, and here I would like to really say more or less segue into the private sector potential for blended finance. Now, we've been speaking about siloed opportunities, but if we want to reimagine the broader healthcare ecosystem, what we have to figure out is that we need to find a way to collaborate, and this kind of collaboration across for-profit, not-for-profit, really trying to pool multiple forms of capital, requires really to be very specific and unanimous about the kind of outcomes we hope to derive. So I think that is really critical for scale. And I'll just pause there.
Thank you so much, Karthik, for giving those examples, because those are the solutions that we also support under blended financing, and I can come to that a little later. But I think what you mentioned in terms of what are the things that you really need to look for in scale is blended financing as a tool, but also blending of efforts of all the key stakeholders coming together with a shared value or a common goal, a common outcome that you're thinking of. So thank you for that excellent point with great examples. Coming back to you, ma'am.
Sorry about this. Part of side effects, and I'm not vulnerable, but COVID did impact me. So let me go back to what I think can be done. First of all, I think the private sector, CSR, and government has to step up funding for the health sector has to increase. India can no more be satisfied spending 1.3 or 1.4% of its GDP. And it cannot say, we will do it. From UPA to BJP, they have all acknowledged that they will, or UPA to, yeah, they all have acknowledged the need to invest more in the health sector, but haven't done it. It's time to do it now. The new budget, the next budget, which is very soon, we hope will hear everybody's voice and the people's voices, where people have been so affected thanks to COVID, has brought out, that's not a good thing, but thanks to COVID. Second, we have to invest in human resources. And there again, we don't have enough human resources in the public health sector. So private sector and public health sector can work together. Then, of course, technology, which we mentioned earlier. And third, scaling up of what has worked in India, in the NGO sector, in the private sector. There are a lot of innovations at the state level, which is in India. NFHS has itself brought out that Mission Parivar Vikas, where they targeted the 140 high fertility districts, how well it did. And so we need to scale up what works, and we have to understand, PFI did, I want to call ourselves Population Foundation of India, because PFI is a bad word today. I do want to say that we absolutely must ensure that the scaling up framework that we developed says it is not everything that can be scaled up. For instance, the adaptive challenges that NGOs work with in terms of mobilization, government cannot do. So leave it for the NGOs to do the mobilization. Leave it for the technologically empowered people to bring in the technology. And the government plays the role of the facilitator in the not just public health sector, but beyond. Third, this is a very good time, I'd like to say that we need to have a better understanding and trust between the NGO sector, which is fast diminishing. The private sector still has an opportunity of trust, but is not regulated. NGO sector has got so regulated that our hands have got tied. But having said that, there are great opportunities for us to work with the Indian CSR. There is a lot of diminishing of international resources. So this is a good time for the Indian CSR and corporate sector to work together and perhaps show the trust, to have a trust, and maybe that can then we work with the government. And there are some sectors particularly I want to bring out, which is education for girls, education for women, family planning. They keep saying population is the biggest problem in India, the private sector, the government, everybody. How much has the private sector contributed? We've been looking for not just grants, but reviewing what the private sector is contributing. It's close to negligent, given that they call population the biggest problem, which, by the way, it isn't. It is a resource, and future of India lies in skilling young people, improving their mental well-being, their education for a demographic dividend in India.
Thank you so much, ma'am. In fact, for bringing out this aspect of, how each of the sectors can actually bring in their own niche areas and let them sort of flourish doing that and provide them with the necessary support. Moving on to Dr. Suranjeen. So at Japaigo, how do you see the importance of network between public, private, and academics to achieve scale? And can you illustrate where these networks have been successful and where it needs to be formed?
Thanks. Uh, so I just want to introduce, some of the work we're doing in the primary health care space. Thanks to the USAID-funded NISTA project, we're working in 12 states across India, trying to catalyze and build primary health care in the country. And over there, we have what we call labs, small labs, where we are doing certain innovations, trying to bring in care. Like, for example, uh, eye care is not something which is readily available at primary health care level. Can we actually provide simple eye care? So these are small investments and small experiments that are being conducted. How do you define mental health care at primary health care level? So apart from these, and so these are some platforms that we readily have with us, and this is an open invitation to anybody here, social impact investors or anybody else, to come in and talk to us. Talk with all of us. Ask the government, and I think co-design, for such scale, to bring in efficiency or bring in more safety or bring in more respect, to what we deliver. And that's one platform, but there are multiple other platforms that have come up, that can take things forward. Thanks.
Thank you, Dr. Suranjeen, for keeping it brief and just giving one example which actually explains a lot of the points that needed to be covered under this question. So, Mr. Singh, what are some of the areas that the government and public health institutions need support to enable efficient use of resources for maximum impact and scale? And how can investors actually provide support for that?
Okay, thanks, Neeta. I'll keep it very brief. I think if you look at the context of where we sit today in our country and probably globally, data is the new oil. The amount of data we generate, right from birth to death, different departments. I think, and the second point is a policy shift can make such a huge difference to scale. So I think today our policies which the government is making, they need to be evidence-based. They need to be using that data intelligently. And then through that data coming out with policies which are very targeted at solutions. So I think that could lead to scale. The private sector can play a big role. As I said earlier, there's a capacity gap where, if you look at the government setup, people are not trained how to sort of visualize this data, how to look at this data, how do we lead to policy through this database evidence. A lot of vital strategies work is focused on this. We work in India with different departments looking at, for example, on hypertension, creating dashboards, visualizing it, seeing where the gaps are. So I think those can be funded on training. Private sector has the capability, to bring in all that which we can do through AI and others. So I think data is the new way to go. Using data to drive policy to change, I think, is the next big thing. And my last point is, when I started looking at this sector, there used to be a term, public-private partnership. It stood for, one guy told me, it stood for Purane Papiyon Ki Pitai. So all the private sector guys used to get bashed up because it was an unequal, partnership. You need to create a win-win partnership. And that's my last point in terms of what can be done. Thank you.
Great. Thank you so much for all the points that you have raised. And I think I'm very fortunate to have had an opportunity to work with all of them, all the organizations here on the dais. And I'd like to bring up, since USAID has worked with all of them, I can actually bring up the perspective that we have for comprehensive primary health care is work closely with the government, as Madam Poonam said, that, identify those gaps and identify innovations or high impact solutions that can fill in those gaps. And while we do that, we right from the beginning look at what are the opportunities and what are the requirements to scale up. We know there are a lot of partners working in this space, lot of stakeholders in this space, and therefore we bring them together, and that's how we have created this comprehensive primary healthcare alliance. We are a part of it at the India level as well as at the global level to share these learnings, and to coming back to the objective of this is to have these learnings and these quick benefits or areas where stakeholders could come together and the results that they bring out and take it to a different level so that they could be scaled up. I cannot complete the session without mentioning about the blended financing initiative that we created, Samrit, during the pandemic. And we have supported, it's a $300 million facility that we created to identify innovations that could fill in the critical health system gaps. And we looked at sustainability and scale up right from the beginning, because we knew that our support has an end and it has to go beyond that. The beautiful part of it is government, financial institutions, not-for-profit sector, for-profit sector, everyone has been a partner on this. And while this has been a great experience, it has been also a challenge to get that shared value together. And there are a couple of my colleagues from IP Global here. They can actually talk to it in terms of what are the challenges that they have faced. But it's very important to get all of them together on the same platform and agree to that shared value partnership. And in primary healthcare, out of the 40 solutions that we have supported in less than 2 years, 10 of them are in primary healthcare space. And we can talk more about it, or you can actually visit the website and check more details about it. What I want to mention here is beyond these 10 are other solutions like aggregators of healthcare services, supply chain solutions, innovations in all of these spaces like temperature controlled portable devices that carry neurosynaptics that you mentioned is again being supported under Samrit. So the learning that we have got from this is immense, that the remotest areas, they have more challenge to face. So, you really cannot get your return on investment immediately, and therefore you need to partner very closely with not-for-profit sector groups who penetrate to these areas. And there are huge opportunities with the other players or the other entities like, as I mentioned earlier, suppliers, manufacturers, or aggregators who have to think about viable business models, and they are amenable to receiving equity and debt funding, and amenable to patient capital as well. So there are huge opportunities. I think it's for us to come together, share these experience and knowledge, and work together with trust. Really, we need to trust each other before we embark on this space. Thank you so much. And thanks especially to all the panel.